The primary immunodeficiency disorder that I chose to research is Ataxia Telangiectasia. For the rest of the PowerPoint, I will just be referring to it as AT because this is much simpler to say than the long name. This is an autosomal recessive neurodegenerative disorder that is also known as Lewy-Barr syndrome or cerebello-oculocutaneous telangiectasia. It is similar to and has been grouped with Bloom syndrome and Fanconi anemia, and some helpful terms that need to be defined before discussing more about the disease are the terms ataxia and telangiectasia. So ataxia is an impaired balance or coordination that can be due to brain, nerve, or muscle damage, and telangiectasia is a condition characterized by dilation of the capillaries, causing them to appear in a small cluster around the eyes and on the skin. And I have a picture here of this hand that is showing what the small clusters on the eyes and skin look like with this telangiectasia condition. Now I'm going to talk a little bit about the epidemiology of the disease. So it's common in 1 in 40,000 people or 1 in 100,000 live births. In the US, 1% of people are a carrier of the mutation in the ATM gene, and males and females are equally affected. There's not one sex that is more likely to be affected than the other. Caucasian populations as well as Mexican pediatric patients are among the most affected individuals with this disease. So what actually causes the condition? This defect is caused by a mutation in the gene coding for ATM, which is Ataxia Telangiectasia mutated gene. ATM is among the most critical initiators and coordinators of the DNA damage response. It controls many important cellular processes such as DNA damage repair, apoptosis, cell cycle arrest, metabolism, proliferation, oxidative sensing, and others. The immune defect involves both cellular and humoral, so T-cell dependent and T-cell independent immune responses, with T-cell dependent regions of lymphoid tissue being affected most severely. AT patients have impaired development of T cells and B cells, and defects range from mutations in enzymes found in all cells, which would have global effects on all of the body, to mutations involving signaling proteins expressed in T cells, such as the ZAP70 mutation. Next, I want to talk a little bit about the clinical manifestation and symptoms of this degenerative condition. As I mentioned earlier, it is a degenerative condition, so it will get progressively more severe over time, and it's characterized by a combination of neurological and systemic symptoms due to the mutation of the ATM gene. It presents in early childhood when there is difficulty with movement and coordination. Symptoms will show signs of the conditions as early as the age of 5. Movements are off balance when they walk, jerking of the arms and legs, twitching their muscles, and slurring their speech. A notable characteristic of the condition is the small clusters that I mentioned earlier of the dilated blood vessels that appear in the eyes and on the skin. This condition also weakens the immune system, and as a result, some common symptoms include fatigue, chronic lung infections, feeling sick more often, frequent infections, and in some cases even leukemia and lymphoma. Finally, I'll discuss the treatment and life expectancy of this condition. There is no cure for AT, and treatment is unique for each person depending on what symptoms are present in that particular individual. Some treatments include avoiding overexposure to sunlight to control dilated blood vessels. Chemotherapy is used to treat patients that have cancer. Physical therapy sessions are helpful to strengthen muscles. And receiving gammuloglobulin injections targets respiratory infections. Antibiotics are prescribed for recurring infections, and diazepam is administered to control slurred speech and voluntary muscle movement. Life expectancy varies based on the severity of symptoms, but most people diagnosed with the condition live into early adulthood up to 30 years old, with the median age being around 25. Early treatment for recurring infections and preventative screening can prolong life expectancy. These are the references that I used for this slideshow, and thank you for watching.